Executive Plastic Surgery, Michigan. So I've just done a very interesting case. 69-year-old lady from California. She had implants from 1985, silicone, the one and only. And so her family member I took care of, she heard about the breast implant illness, and now workup shows that she has indeed what is a rupture, because just the fact, the length of time alone, she has had what is a rupture till proven otherwise. 38 years old, set of implants. So you can imagine back in 1985. So as you can see, I cut out the excess skin. There was this tissue at the bottom. You can see it does not look healthy, especially up at the top. It looks dusky. You can see some of the scar tissue, so I removed it. And you can see just holding it, you can see it does not have much of a consistency, which is very typical standard of what is, a ruptured implant on the inside. So this was done en bloc fashion. And as you will see, as I cut this open, you will see clearly what is all contained. Now, some of these areas were relatively very, very thin as I dissected. And lo and behold, as we knew, this is what is a rupture. All contained. She has no drains. And you can see this is literally going to be, I'm going to move this aside, and you can see like literally disintegrated implant. And look at the color. It's, patients have asked me how long do you think it look? It's like literally molten. And the way it's going to spread out, it was all contained. You can imagine if there is a small cut, how this is going to spill into the chest. And if I'm going to turn this around and let's look on the inside, you can see some areas. This tissue right here is going to be evaluated for the BIALCL. See right here? This tissue that's floating off. And I'm going to leave it inside. I don't want to cross-contaminate. I'm going to leave this out inside. So again, very important to rule out. You look at these patchy areas, right? Now, overall, this is all contained. None of this spilled into the chest. Remember, this is the whole goal of the surgery. I talked to a patient yesterday. Look at how this yellow. I talked to a patient yesterday. She went to an explant surgeon who, unfortunately, this spilled into the chest. We don't want that to happen. So I'm going to go ahead and rest this here. And I'm going to change my gloves. You can see the shell. I'm going to pick this up just so that you can see. This is the shell, the outer layer. And you can see how this is completely disintegrated. Now, this is the older technology. Patients say, well, I got the gummy bears. No, the gummy bear is the same thing. It's a little bit more cohesive, but essentially the same problem. The silicone is leaching. So the cohesive implants are certainly not safe. Now, this is the con procedure as I change my gloves. No lift. This is not the time to be doing a lift. There's so much inflammation. And I'll tell you, looking at her age, 69, and the way how everything got together, especially with the cutting of that excess skin, I'm very happy how everything is looking. No drains, no need for a drain because of the minimal blood loss. It was like 5 cc's on each side, a total of 10 cc's, and that has been persistently the case for well over 99% of my patients who I've done high definition pictures and video of the chest wall plus cutting open of the capsule. The pathology, the capsule is always sent to pathology for the CD30 analysis, rule out lymphoma, rule out malignancy, rule out the BIALCL as you see in the brackets. Microbiology cultures for aerobic, anaerobic, and fungal, always sent to microbiology. And then the twilight anesthesia where the patient's literally snoring / sleeping through her surgery. Remember, to date, not a single patient has had any recollection. The implants are returned to the patient, and all patients, regardless of the age or comorbidities, they get the same surgery. Now, on the left side, this is the left side, and I'm going to go ahead and write this down. On the left side, by convention, you will see that I cut out the excess skin. That really helps, again, with the aesthetics. The small piece of tissue at the bottom, I'm going to send with the capsule. As I was dissecting, you can see everything went well. Now, this was the part, this was against the rib. And so as it was sitting against the rib on the chest, like so. So when I was dissecting, you can actually see This is the part that was against the rib. You can see, look at the rib. I removed some of the cartilage. You can see the markings right here. Rib, rib, rib. Now, as I was dissecting over here, you can see this area. There was a small cut that inevitably occurred as I was dissecting off of the rib. Remember, which is the hardest part of the case. So as I stick my needle in, as I stick my, this is a small cut. Now this is, remember, as soon as this happened, I was able to take a plug and contain it such that none of this spilled into the chest. And all of this was contained. And so by definition now, this was very tedious. You can see, look, this is part of the rib right here. You can actually make it out. This is the rib. The layer directly on top, and this is what I say, the periosteum, the perichondrium, that's the layer directly on top of the rib, is removed such that all of this inflammatory burden is removed. You cannot leave this tissue behind because this has part of the badness in it, right? So what I'm going to do is I'm going to now go ahead and cut from this area, and clearly, as we know, this is a ruptured implant and all of this was contained. So as I cut, you will see this is again part of the rib. The layer directly on top of the rib was removed along with the capsule. And so this is the take-home message for this Facebook Live. The periosteum, the perichondrium, which is right here, is removed along with the fascia of the intercostal muscle, the fascia of the serratus anterior, and the fascia of the pectoralis minor, incorporating it with the capsule. And as you will see as I go in, I'm holding part of the superficial layer of the rib, and you can see how hard it is. And so all of this tissue, you cannot leave this behind. And I find a lot of surgeons leave this behind because this is indeed what is the hardest part of the case. So I'm cutting through this only for you to see how this implant is. And again, completely encased. None of this spilled into the chest. If any of this spilled into the chest, automatic drain requirement. And there's certainly no need. So as you can see right here, I'm going to invert this. And let's see on the inside, you can see this kind of a mustard type of an appearance. All the way in here. All contain relatively thicker capsule on this side. And again, like a molten silicone. And you can see the shell of this implant that's ruptured. And none of this spilled into the chest, despite a small hole. And again, the care was done with absolute precision such that none of this spilled into the chest. Even if there was a break in the capsule, it was contained. So none of this, as you can see, spilled into the chest. The moment this spills into the chest, automatically 100% drain. And no matter what and how much, the drain is not going to clear it. No matter how much 10 liters of normal saline you take to clear it, it is not going to clear. Unfortunately, the damage would be done, and this would be the catastrophe that the patient would have to live with. So it's the surgeon's burden and expertise where the commitment is made that the entire implant capsule, all inflamed tissue, including the perichondrium, periosteum, is removed, and it absolutely can be very, very tricky, as you can see. Who wants to remove that small superficial layer of the rib, and which is exactly what I did, in order to contain all of this, that none of this silicone spills into the chest. And that's the take-home message. The other thing is the older implants and certainly the newer implants, the cohesive gummy bears, eventually all disintegrate and all rupture. And so there is no such thing as a safe cigarette. There is no such thing as a safe implant, be it a cigar, be it a cigarette with a filter or a nice big filter. No, they all cause cancer. In this case, the implants are certainly not safe. The silicone in itself was contained, and all of this was done in a fashion where the end block, if not, everything is contained, so none of the silicone spills in the chest, and there is no need for a drain requirement. Many of the surgeons choose to just cauterize this tissue that was removed. That's not good enough because the capsule inevitably then remains behind, and that in itself, a small amount, will be enough to continue to trigger that immune response. This is Dr. Khan, Executive Plastic Surgery.